the biggest COPD management first steps would be to make sure you're on the right respiratory medications. So today's presentation, we're going to do the what, when, and how of respiratory medications. So we'll discuss what medications are out there, when you should be stepped up to those medications, and then we'll discuss how to take them properly. And Pat and I'll kind of tag team on the how part just to demonstrate proper puffer technique. All right. So this is the large amount of different puffers that are out there for patients to be on if they have COPD. And as you can see, it can be overwhelming. A lot of doctors are even overwhelmed with it because it's just a lot. So I'm going to try to break it down as simple as I can. And please, if you want to ask questions, you can either type them in the chat box, or you can come on mute and ask a question if you need some clarification. And we can do that as we go or at the end. So the first medications that most people are started on when they're diagnosed with COPD is to have a short-acting medication, okay? And short-acting medications can come in single medications, meaning there's one medication in each puffer. So there's Atrovent, and then there's a few others, which normally it's Ventolin or salbutamol that fits into those two groups. So if we look, there is also a combination medication, and the combination medication is what they call CombiVent, okay? CombiVent, if you read the really small print, is actually a combination of Atrovent with Ventolin. So you're getting your ibuprofen bromide is the big name for it, and your salbutamol, or your generic or your brand names are Atrovent and Ventolin, are inside that one medication. So you're getting two short-acting medications in one puffer. The thing that I like to point out is with the short-acting medications, you can use them regularly, or you can use them if you are having a day that's a little bit harder. So that's what the PRN is. PRN is as needed, okay? So your Atrovent, or your ibuprofen bromide is the other name, can be used on a routine basis and as needed. And so same with your medications such as Ventolin. I don't know if anybody's on Bricanel, that's another kind, and Aramare is another kind, but Ventolin is kind of your generic quick reliever. And then your CombiVent too. You can use that regularly if you're on it. And I even have patients, I don't know why it doesn't have as needed, because you can use your CombiVent as needed as well. So,
Tam,
yep.
Sorry.
Yep.
Can you go back to that slide, and can you tell them the difference? Because it's a SAMA and a SABA at the top. So, yep. Can you explain the difference?
So you know what? I'm gonna on my next slide, Pat, but thank you for bringing that up, okay?
Okay, thanks.
So when should you be changed to a different puffer? Okay, so this is kind of, and I lied to you, it's not on the next slide, it's on the next one. So reasons why you would need to have a bump up on your puffers is if you've had breathing tests, which everybody said they have, and it shows that you're having, you have moderate to severe COPD. So you can be bumped up before then if the doctor thinks it's appropriate. However, to get funding is another issue. So, and we'll discuss the funding options after we go through this, and maybe that will make more sense. But for funding purposes, you need to, your breathing tests need to show that you have at least moderate to severe COPD, and it's a certain number that you are able to breathe out on that test. And the doctors would look and see if you did. The other thing that really is to show your breathlessness, okay? So breathlessness normally is what we would say is a grade 3, a grade 4, or a grade 5. Again, that's more than you need to know, but basically if you have to walk slower than somebody of the same age, or have to stop after 15 minutes of walking at your own pace, that would qualify that you would need to be bumped up on a different puffer. Okay, if you're even more breathless than that, such as having to stop walking after 100 meters, or you're even too breathless to get washed and dressed without having to stop to catch your breath, all of those would be good indications that it's time to bump you up to another puffer. And then the other thing, again, that doctors may look at to know to bump you up to another medication is if you've been on antibiotics at least 2 times in a 12-month period due to a flare-up of your breathing, and or if you've been hospitalized at all because of your breathing. Okay, so those are all kind of indications that doctors would use to know that, okay, what we have you on isn't quite cutting it. You also, it's good to know when you can be bumped up, because you can go to the doctor and say, hey, listen, I've been on antibiotics twice and I'm still not where I think I should be for puffers. Okay, so that's the indications for when you would move from a short-acting medication to a long-acting medication. Okay, so the short-actings, the ones that we talked about back here, the short-acting medications only stay in your system for about 4 to 6 hours. So that's why you're allowed to take them 4 or 6 times a day, every 4 hours or every 6 hours if you're feeling breathless. The long-acting medications, they stay in your system for either 12 hours or 24 hours, depending on what medication you're using. So there's 2 different versions of long-acting medications that are single medication. So there's only one medication inside of that puffer, okay? There is what we call the long-acting muscarinics, okay? And then there also is the long-acting beta-2 agonist. Those are very special words. You don't need to remember them, but it basically tells you, it's kind of like there's 2 different cars. Which car are you gonna pick off the lot? So doctors would start you on a single acting medication, and what they normally would, if you notice on the bottom, the long-acting beta-2 agonists very rarely are ever ordered by a doctor. And I've asked doctors why they don't go to that kind of group of medications. And they said there's sometimes more side effects with them than there is with the long-acting muscarinics, okay? So these ones are the ones that you would probably be on if you're on a single medication. So I want you guys to take a boo at that. And see if you're on any of them. So there would be Incruz, there'd be Seabree, Spiriva HandiHaler, or Spiriva Respimat, and Tudorza. So those would be your medications to know that you're on a long-acting single medication. And when you're on these ones, you want to use them routinely. So you want to use them as directed. You don't want to wait until you're having a day that you're short of breath. You want to take these routinely, so hopefully you don't become short of breath, is the hopes of them, okay? So here's the question, or what Pat had mentioned. So when do you have too much of a good thing, okay? So you're on a long-acting muscarinic, okay? But you'll also have a short-acting muscarinic. So right here, that word right there. That is, you don't want to be on that same 2 of the medications. So you don't want to be on one of those categories under the long actings and on the short acting, because you actually are getting too much of a good thing. You're basically getting duplication of a medication. Therefore, you're not getting any extra benefits from it, but you're getting more of the side effects from it. So we don't want you to be on both. So if you're on a long acting medication, you normally get stopped on the short acting medication. Okay, so again, if you notice that you're on one of the medications in the column of the long acting, then you might want to talk to the doctor about discontinuing your Atrovent if you're still on Atrovent. Okay, so now you're on the long acting single medication, okay, but you're still breathless. When do we bump you up? All the same things as the last one. If you're still breathless, if you're still walking at a slower pace, if you've been on antibiotics, then the single long-acting, the long-acting muscarinics isn't doing enough for you. So that's when we want to go into a long-acting dual or double medication. So these medications have your long-acting muscarinic, but it also has your long-acting beta agonist. So it has two medications that stay in your system for a much longer period of time, and the two of them together are doing the best they can for you. So again, look at the medications that you have in front of you and see if you have Anoro, Duclair, Inspiolto, and Ultibro is the other one there. Okay, so just look at what's in front of you and see if you have that, so you know if you're on a double acting or a dual acting medication. Again, if you are, you want to take this routinely. And again, most of those medications, they either stay in your system for 12 hours, so you would take it twice a day, or it stays in your system for 24 hours, so you only need to take it once a day. And we'll discuss that in more detail as we go along. So 2 is better than 1. So if you are on a combination medication that has 2 medications in it, then you want to be stopped on your single acting, because as mentioned, those medications are in the new puffer for you, okay? And too much of a good thing cannot be a good thing. So you want to make sure if you're on a double, you're not taking the same medication in a single inhaler. Any questions so far, or we'll save them for the end? Anybody want to type anything? Like I said, as we go through, just let me know. So there is another type of medication, and this type of medication actually is for people that have COPD, but they also have an asthma component. So again, a lot of people say they have asthma, but the breathing test that they have had done verifies if there's an asthma component to their COPD. And if there is an asthma component to their COPD, they could be on this type of medication. And what this medication is, it has a long-acting medication in it, but it also has a steroid in it. And the steroid is there to help get rid of inflammation in their airways that is associated with asthma. With COPD, there's inflammation in your airways, but that inflammation is what we call chronic inflammation, which means it doesn't normally go away because it's there because we've inhaled irritants for so many years, your airways are just chronically swollen. So with asthma, the steroid will help with the swelling. With COPD, it's not necessarily our first line of defense to help with the swelling, okay? So these medications are what's listed there. So you could be on Advair. Now the picture of Advair here is what we call in a discus. It's the round little contraption or puffer style. You can also have it in what we call a meter dose inhaler, which looks like your Ventolins or your Atrovents. It's in the same little device, but it's a purple. You could be on Brio or you could be on Symbicort. Okay, so again, just look and see if that's something that's in your arsenal of respiratory medication. When you are on one of these medications, it's the same thing. You're going to use it regularly. And there is a little note there that you see that says gargle and spit after each use. The reason why you need to gargle and spit is because of the steroid. Because if the steroid sits on your tongue or it's in your mouth for too long, it can actually cause thrush, which is a bacterial infection that can really hurt your mouth. So we get you to rinse your mouth. It's only the puffers that have the steroid that you actually have to rinse your mouth out after. Some people rinse their mouth out after every puffer. That's fine, but it's really only the steroid that it's indicated in. So we're on double acting, okay? We just had the ones that we have 2 medications in, but you're still short of breath. There is one final way to bump you up for respiratory medications. And again, the indication for that is if your breathing tests tell you, if you're still breathless after they've bumped you up on the dual acting medication, if you've had flare-ups that need antibiotics, or if you've been in hospital because of breathing. Those, again, would be all indicators to bump you up to the next step. The next step is what we call triple therapy. So triple therapy has your 2 long-acting medications, okay? It has the long-acting muscarinic and the long-acting beta agonist, plus it has the steroid. So I just finished telling you that steroids aren't where we first go for somebody with COPD. but it's kind of our last trick in our bag to help you with your breathing medications, because maybe it will help you a little bit, but we don't automatically go to the steroid first for COPD. Whereas if it's strictly asthma, steroids sometimes are the first ones we would go to. So your triple therapy, you can actually get it all in one puffer. And that puffer is called Trilogy. So Trilogy is the only puffer on market as of now that has all 3 medications in it. There is a new one coming out to market. I don't know when it's coming, but I've heard rumors that it's coming sooner than later. But for now, Trilogy is your only puffer that gives you all 3 medications in one device. However, you can get triple therapy using more than one device. And basically it's just mathematics. So you're going to take your puffer that has your long-acting beta agonist and your steroid and add with it your long-acting muscarinic. So remember, your ICS lab is 2 medications and your LAMA is 1 medication, and put them together, you're getting all 3 medications. And that's what you would, when we would say you're kind of maxed out on respiratory medication. So you're on the most you can be. With all of this, the other puffer that is never taken away from you is your salbutamol or your Ventolin, your blue puffer. Your blue puffer should always be available, even if you're on triple therapy, because that's always your go-to, or people might have told you use it in an emergency. It's when you're having a day that you're more breathless that you would go to that blue puffer. You wouldn't give up on using these ones, but you could still add on the salbutamol puffer. I don't know if it's, oh, there we go. So what devices do you use? So in all those medications, there's a lot of different devices to give you the medication. So your first device with the short actings would be called a meter dose inhaler. For some reason, it doesn't want to advance for me. Oh, we're having computer malfunction, people. Oh, now I'm not. So your meter dose inhaler is what the picture is there. It might be blue, it might be white, it might be any color, but that's what we call a meter dose inhaler, okay? And then with a meter dose inhaler, we are going to recommend that you use a spacer or an aero chamber is another name for it, to ensure you get the medication properly. And we'll go over that technique very shortly. Another device is what we call the ellipta device. So this would be your Incruz, and I'm saying these names so you can kind of take a boo at what you have. There's Incruz, there's Brio, there's Anoro, there's Trilogy. Okay, so there's 4 different medications that come in this type of device. And then your other device is what we call a Respimat device. And a Respimat device has a couple different medications as well. You can look at the names on yours. It could be Combivent, it can be Inspialto, and it can be Spiriva. Those are the 3 medications that would come in that kind of device. And then your other device is a HandiHaler. The HandiHaler is only used for Spiriva. This used to be the way the manufacturer gave out Spiriva, but they've now put it into the Respimat device, which is shown to be a little more effective. So you might have been on the HandiHaler before, but you might have got switched over to the Respimat or vice versa. So there's 2 ways to get Spiriva for medication. Your other puffer is what we call a Turbuhaler, and the Turbuhaler would be your Symbicort, it could be Pulmicort, it could be Briconel. Those would be in that type of device. And then this one is your Genuair. And I can't remember what are the medications that come in the Genuair right off, Pat?
Tudorza and Duoclear.
Okay, very good. And I said that because it's not as prescribed as some of the other ones, but if you have them, we'll discuss it. And then your Breezhaler, is it Seabree that's in this one? And what other ones in Seabree?
Ultibro.
Okay.
Yeah.
Yeah. And then The last type of device that we would have is the discus. And the discus, you can have Advair, you can have Flovent, you can have, actually Ventolin will come in that form as well, rather than that top form of the meter dose inhaler. So those are kind of all the devices we'll talk about, because regardless of what medication is in the device, how you suck that medication out and into your lungs is what really matters. So we'll make sure, hopefully you'll have a good understanding of that before the end of the day. And then how to use your puffers effectively. We are going to demonstrate them, but for every puffer, no matter what type of puffer or how often you have to take it, you have to do a few steps all the same, regardless of the puffer type. So before you take any puffer, we normally suggest to breathe out or exhale as much air as you can in your lungs. So just do a nice, easy exhalation. You don't have to do a very fast or forceful. So just do a, all right. Try to empty your lungs as much as you can, so that when you suck that medication in, it's going to get down as far in your lungs as you can. So you don't want your lungs to be half full of stale air, because when you breathe it in, it's not going to get as far down. So breathing out before you take every puffer is what really should be done. You're going to take your puffers as instructed, and that's going to be our next part, where Pat and I are going to demonstrate a few for you. And then after you breathe in the medication, the next thing that you want to do, regardless of what type of puffer you're taking, is do a breath hold for a count of 5 to 10 seconds. And the reason for that, if you breathe in the medication and you breathe right back out, the medication is being exhaled before it gets down into your lungs and starts to attach to the lungs and start working. So you want to do that breath hold after you breathe in the medication for 5 to 10 seconds. And then if there is a second dose indicated, so if you need to take 2 puffs, because some medications it's 2 puffs twice a day or 2 puffs however often, you do normally want to wait 30 seconds to a minute in between puffs before and repeat the same process throughout them. And that is all the puffers. Clear as mud?